Vaccines for teachers, schools waiting to cash checks from the federal government, and the mental health of our students, plus proposals the Nebraska legislature will hear this year, and an update on the COVID-19 pandemic. All of that is ahead on Speaking of Nebraska. Thanks for joining us on Speaking of Nebraska. I'm NET News Director Dennis Kellogg. Teaching, like most things, has been drastically changed by the pandemic. It's made teachers and administrators rethink allowing children to get up and get a drink from the water fountain or consider teaching in the classroom at all. The coronavirus has no favorites, and it has even bullied the Nebraska Teacher of the Year.
My name's Paul Tim. I'm a middle school, high school science teacher at Lyons-Decatur Northeast Public Schools in Lyons, Nebraska. And I'm the 2021 Nebraska Teacher of the Year. With the attention on the dials and the increasing rates in COVID cases, I didn't know if I was going to make it halfway through my cross-country season without seeing the season just done. Praise God, we were able to make it through the season. But it was that state cross-country meet that weekend that as I look back, that is where I contracted COVID. I was gone from school for 2 weeks, and 3 of my 4 family members ended up developing symptoms. During that whole time, I was not directly video teaching with Zoom, but was creating and delivering lesson plans like I did in the spring over Google Classroom and Canvas, and basically taking my curriculum and completely remaking it while I was sick. But there were days I really couldn't put forth much energy for that. I just kind of had to keep treading water because I wasn't feeling too good. So eventually I got back to school about mid-November. And that week, our whole staff was kind of struggling with that. We had some staff members out. We had a bus driver that was no longer able to continue to drive due to concerns with health and not wanting to be exposed to COVID. And so I'm one of the very few staff members that have a bus license for my coaching purposes. And so I was in the driver's seat for driving route morning and night. My biggest concern is just fatigue that people are experiencing, and the result of that fatigue being people being apathetic, and then COVID spreads. As a science teacher, I know biology is no respecter of opinion or our personal emotions. It's hard though, when you see the community spread taking place, you're asking for people to try to help. And their opinion of what helping is, or their acceptance of the knowledge and recommendations that our medical profession is making for them to carry into their lives at local restaurants or at the gas station or while doing business, they maybe don't feel the same importance. That's difficult for those that are doing as much as they possibly can according to the best knowledge we have on COVID to ensure their children are safe.
Joining us now are Matt Bloomstead, the Nebraska Commissioner of Education, who's also a member of the NET Commission, and Jane Hansmeyer, a Norris High School teacher. Thank you both for being with us on Speaking of Nebraska. Well, this year has been like no other for so many reasons. Education is no exception. The pandemic forced learning completely remote last spring. Many 2020 seniors didn't get an in-person graduation ceremony. All schools in the state returned to some form of in-person instruction this fall. So, Commissioner Bloomstead, let's start with you and kind of give us the state of education, if you will. How do you feel it's been? It's been a crazy year.
It's definitely been crazy. I mean, one of the challenges, and I think I stated this at the beginning of the school year, like on a Twitter. I said the top 5 things that are going to get us through this school year are teachers, 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 and teachers, and teachers, right? So anyway, the reality is there's been a lot of hard work, a lot of concerns around what the safe protocols needed to be, and I think we've really done a very good job, and across the state done a very good job of understanding that. I think when things got a little rougher, I think as far as the spread across the state in November and December, we were getting a little concerned where things are at, but we really try to use schools not just as a vehicle where we think they're the safest place for our students to be across the state, but also as a vehicle for learning about how to be safe in the community at large. And I think that's really one of the great credits to our school officials and teachers across the state for what they've done on that side of the education arena too.
Jane Hansmeyer, how is your classroom different this year in the middle of the pandemic than it has been in past years?
It's different. Everything is different about it. You can look at it when you walk in the door and the spacing of where students are. You can look at everything that's happening before they walk in and after they walk in. So if it's trying to keep everything clean, you can see that. But also there's just a different feeling when you walk anywhere in the school. Definitely in the classroom, students know there's places they can go and places they cannot go. And perhaps we were a little more lax with that prior to the pandemic because we didn't have to think about it. And now we've had to think about pretty much everything A to Z and what could happen and might happen and what if, and then what happens after that.
And I want to get into how students and teachers are both handling it in the school system with both of you, but let's talk about vaccines. One of the biggest news topics across the country, of course, vaccines. They're being distributed across the state. So far, more than 53,000 doses have been administered in Nebraska. Educators are essential workers qualifying in the second tier of the state's 1B phase of vaccinations. The state, however, has said it wants to prioritize Nebraskans 65 years and older before those essential workers in that group. So, Jane, as a teacher, how do you feel about having to wait longer to get vaccinated?
We're ready. Whenever they decide, we are ready. It's only right. There's people who absolutely need to be ahead of us, who need the vaccine prior to us. With that being said, I'm in a school building every day with 700 plus students, as are all of my colleagues, and that's hard because they bring everyone from home to school with them. Mm-hmm. And so we need to just know that we are pretty much on the front lines, and we do need to never let down, as Commissioner Blumstead said earlier. We cannot, because there's not we don't have a good answer if we do.
So Commissioner Blumstead, around the country and even in Omaha, some teachers saying they're not willing to return to the in-person teaching until they're vaccinated. The Chicago Teachers Union, for example, voted to teach remotely until teachers get vaccinated. Most school districts in Nebraska are open for in-person instruction, so teachers moving back on that priority list. Do you think it's fair for the teachers to have to go in and teach when they're not vaccinated?
I think what we've seen in Nebraska and really across the country, that if you follow all these protocols, that it can be a very safe environment for teachers to work in and be in. I can completely understand why folks would hope for the vaccination and much sooner. And I think, as Jane is saying, I mean, the reality for teachers, they're putting themselves on the line at every moment in time during the school day. We do hope that as vaccinations become available, we're right in the next order of getting this done. Different than other states, Nebraska is not having a problem about actually distributing these vaccines. I think we've heard from across the country, including Chicago and other large places, where they've struggled. Just if they get vaccine, they don't have a great distribution method. We've done a really good job. Our local health directors have done a really good job. We've worked with all of our school officials and local health directors to build plans to vaccinate teachers as soon as that's available. And I think that's going to be the important part. I understand the hesitancy from folks going, I don't want to go back in without that vaccine. Yet at the same time, follow these protocols. I think we've proven that they can keep people safe.
I want to also talk just in general about the safety of the schools. Jenny Benson, the president of the Nebraska State Education Association, in a public statement about Governor Ricketts this week, said in that statement that teachers are literally putting their lives on the line daily, teaching in person, often without schools fully following CDC or even DHHS Centers for Disease Control or Department of Health and Human Services guidelines. So who is making the call? Who should these schools be looking to? Is it the Department of Education? Is it the CDC or the DHHS?
Yeah, it's definitely that mix, and we actually went through discussions. I would tell you that basically if I could mandate that schools had masks and had to wear masks, I would actually do that. We've looked at the law. It's unfortunately not possible for me to be able to do that per se. And working with the governor over time, we've tried to make that local decision making so people buy into it, that the use of masks and precautions are in place. And I've had plenty of times where we've had outreach from schools where, hey, look, these practices could be improved. Let us show you how. Work with your local public health officials and get those things in place. Our guidance says wear masks throughout this, use social distancing. But we've also learned and gotten better, like the cleaning. I know I've heard from teachers, it's like the amount of cleaning and time that they're doing. Hey, look, we're seeing less of it, being spread through contact. And so put our energies where the best results are, and that's mask wearing, social distancing, and using all those extra precautions as part of it. Where we have places that say that they want to resist any of those, we've seen problems, quite frankly, like where there isn't mask wearing and otherwise, we've seen more problems. And so it's about following those guidance principles and documents and putting us in a position to be successful.
And Jane, there's a lot of stress on teachers, and a lot of people may not think about that, but you put a teacher in a classroom and even in a hybrid situation where they're teaching students in the classroom and online at the same time, it can be very stressful. Can you talk about some of that stress that you've seen as a teacher at Norris Public Schools?
Absolutely. At Norris Public Schools, we have been fortunate because we have done all in-person learning from the beginning of this semester and now second semester. So we have not had to experience some of the things that other schools have. With that said, the amount of stress and duress and the what ifs that teachers had from March on has been something that we haven't been used to. Sometimes in education, there's a question mark and there's a gray area, and our gray area got so much larger because of the pandemic. And we're the teachers. We're supposed to know things. And we're supposed to go to our administrators, and they're to know things. And so everyone was treading water, and there were times when we didn't get very far, and then there were other times where we did. And thankfully we have NDE, and we have the CDC guidelines, and we have such great people helping us that we were not alone, though it did seem very alone at the time, even though everyone in the whole country was going through the same experience.
What I would add to that, as Jane says, we all felt alone together, right? Yes. I don't know how to describe it well, but what I'm most proud of in Nebraska, so we were making decisions about how to return safely to schools in April and May, knowing that the devastation for students not being in school was going to be so detrimental. And so really everyone was, I had so many people calling and say, well, what are we going to do? I'm like, I wish I could tell you I knew exactly how this should go, but we're going to do that together. And that's what I'm most proud of in Nebraska.
And is there anything that the Department of Education can do to specifically target the stress that these teachers are in right now, or is that a district-by-district thing?
It's both. And we've actually worked with DHHS, worked actually with the NSEA on talking about strategies to help folks with the stress levels. Some of us just, teachers are by their nature very responsible people, and we have to think of ways that we help them kind of remove some of those stresses from their day-to-day activities, but also just knowing that they aren't in it alone, that we're all trying to find different ways. There's some different support resources that we've tried to make available. But in total, I think we're just getting better at understanding, take a little bit of that stress off. I've tried to provide some guidance to schools to allow teachers a little bit more planning time, think about this really thoughtfully, and you don't have to be perfect, right? I think this is one of the hard things for teachers. They so often really want to make sure that they're getting everything done perfectly, and that's an added stress that I hope they can take off themselves, knowing that we're going to work together to get through this recovery too.
Jane, you're the coordinator of the Coordinated School Health Program at Norris High, and it's been widely reported this year that this year in particular has been especially tough on students from a mental health kind of standpoint. Can you talk about, as a teacher, how do you reach a student that's going through a lot more than they've ever had to go through outside, even before they get to school?
Well, I have to take my hat off to all of the people who have done such a great job of putting more tools in our toolbox so that we're able to handle that, because we maybe had 5 or 10 or 15 before, and now we have so many more. And it's so different from each student's perspective. And so we have had to give a lot of grace this year to ourselves and to these students and to their families. We have had to be very transparent, probably more than ever before, and very trusting, and know that if a student says, I can't, that means I can't. And you can only go so far with that student, because there's so much more than just that class, those 44 minutes at that subject matter. So I think as far as what we're doing doing something every day, and it's not just a counselor, it's not just the social workers, it is truly everyone from administration to those in food service. Everyone has their ears and eyes open, perhaps more, and sometimes out of bad comes good. And I do think that is probably one of the best things that has come from this.
That's good. Nebraska is going to receive $243 million from the federal government for K through 12 education as a part of the Education Stabilization Fund from Congress. We know how much schools will get. For example, Omaha Public Schools will get over $86 million. Lincoln Public Schools will get over $27 million. What we don't know is what the schools plan to do with that money. Commissioner, what guidance will your department give schools regarding that money?
Yeah, and it's very, I think, in a sense, really directed at what the nation needs as a whole, right? The language that's there. And so it has some flexibilities, but we're definitely going to provide guidance, because we think we're at a point in time where really focusing on the academic acceleration that needs to take place to help students be back to where they need to be. The supports for teachers, I think, are thinking about extended learning. Like, learning doesn't just happen in schools. How do we support parents? How do we think about the summer more as another opportunity for recovery, both for teachers and for students in the midst of this? And so we'll be offering guidance that really looks at that. We'll also use some of the funds available from a state perspective to think about scaling certain resources. So, where remote learning was so difficult, how could we use some of those resources to think about making sure every teacher had access to materials that are going to be helpful for them, and even for parents relative for their access to those materials overall. So we've done a lot, I think, in the last several years. This is a big investment from the federal side to make a difference. I will note that the funds go out based on a poverty formula. And so, again, I think our intentions around addressing poverty, addressing the challenges that we've seen over the last year. I mean, everything from talking about race and behavioral and mental health, and the types of things that we know coming out of this need to be shored up again. And that's where we'll be. But I think I'm worried that, just from the capacity of schools, they're burning up a lot of energy and time right now. I think these resources are going to help us support them all the better and support the recovery of our students too.
As we wind up our time, Jane, I want to ask you, there's a national survey that just came out this week from a nonpartisan group called Public Agenda, and it showed that most teachers and parents think communities value teachers more now than they did before the pandemic. Are you seeing that?
I think where I am at, we never felt undervalued, but definitely I think through this pandemic, it was education that in many cases carried our country. And so I do think that we are valued, and I also think that we value each other a little more as well, because it takes a village.
It does. And Commissioner Blumstead, I want to ask you, we've been through this now, not quite a year, but it's been a completely different type of learning. So are there any lessons, I think I asked you this last spring when you were on this program, but are there any lessons that we've learned during the pandemic that we can take forward after the pandemic is over, do you think, when it comes to teaching and learning?
Oh, I definitely do. I mean, this focus on individual attention to students, right, whether in person or remote. And so if we've struggled remotely, it's about that in-person attention to what the students really ultimately need. We've also learned that we can do some things together, I think, all the better. I think we can scale some things up in different ways. I think we've learned to be a little more forgiving of one another. There's been a lot made of accountability systems and assessment systems, and we need to make sure that those are focused on the right reasons, right? These are all about helping students learn and be successful for their futures, and that's where we're going to take the moments that we've learned from here and build on that and make this, again, I truly believe Nebraska can be the best education system in the country and in the world, and we're going to keep working on that, certainly.
Nebraska Commissioner of Education Matt Bloomstead and Norris High School teacher Jane Hansmeyer. Thank you both for being with us on Speaking of Nebraska. Appreciate it. This interview and tonight's program are available on our website. Just go to netnebraska.org/Speaking of Nebraska and join the conversation on social media. Find us on Facebook and Twitter at NET News Nebraska. Let's take a few minutes to get you updated on the latest news about the COVID-19 pandemic. Dr. John Trapp is a pulmonologist and chief medical officer at Bryan Medical Center and a key member of their COVID response team. Dr. Trapp, thank you very much for being with us.
Thank you for having me here today.
Well, currently in Nebraska and nationwide, COVID-19 deaths are increasing. It's a trend Dr. Anthony Fauci, the chief medical advisor to President Biden, told NPR this week that we could see for weeks or even months more. But cases and hospitalizations are dropping in the state. They have been since the massive peak in November and December. Most healthcare workers and long-term care residents are vaccinated in the state. So, Dr. Trapp, the first question is just give us the general state of the pandemic right now. How do you think it's going? What do you think is next?
Wow. Well, it's been an incredible journey going back to the beginning of the year and how much knowledge we've gained throughout this entire pandemic. We've been anticipating a peak and eventually did see that in really beginning in September, October, but really peaking in November. High hospitalization rates and unfortunately a lot of sorrow during those times. So we are really pleased to see the trend downward. We were very concerned around the holidays that we'd see a peak after that. We really have not seen that big peak. I think people are really working hard to do the things we've been asking them to do with masking and social distancing and just being cautious. So we're hopeful to see this trend continue downward, and as more vaccinations go into place, continue to see decreasing numbers.
So as far as those vaccinations are concerned, we're getting into phase 1B where you're looking at people 65 years and older, people with high-risk conditions, and then the essential workers will wait after that group. It's going to take quite a while probably to get through that group. Do you think that's a good decision to do it that way?
Well, certainly you want to get the population that's most at risk for hospitalization and not doing well with this virus. So 65 and older, additional conditions certainly makes a lot of sense. Younger individuals less than 50 tend to do fairly well with this virus. Unfortunately, there are some exceptions. So yes, you want to get your most vulnerable population. The biggest limitation right now is just the number of vaccines available to the state.
And are we seeing that trend? Are you hopeful that that's going to get better, that supply situation?
Oh, exceptionally hopeful. We hope that as they ramp up production and continue to do that, and as more people are vaccinated, we will see additional vaccine to the state that we can deliver into arms.
As a pulmonologist or a lung specialist, talk about what you've seen, the impact of COVID-19 on the lungs.
Well, the presentation is generally with symptoms of fever and cough and a sense of shortness of breath. A lot of people may not even be aware initially that they're sick, and we see people present eventually with increasing symptoms and fatigue and find out that they're low on oxygen levels. When we take chest imaging, we see a viral pattern of pneumonia is what we typically see. We support those patients in the hospital, giving them the available treatments that we have, and those are limited. And we really provide best supportive care and hopefully see this gradually improve with their lungs based on their oxygen levels. It's interesting, we'll see people who appear to be stable for a while and all of a sudden dramatically get better, and we send them home a few days later. And on the other hand, we see some people progressively worse, develop a severe lung injury process that results in higher needs for support.
And in just the few seconds we have left, do we have an idea yet about the long-term impact of COVID on the lungs?
I think we're still trying to really understand that. I think there's many questions out there about how this will impact individuals, and so I would say it's still a lot to learn on that.
All right, Dr. John Trapp, thank you very much. And we do want to remind people that if you have questions about the pandemic, about the vaccines, you can go to the Bryan Medical Center website, bryanhealth.org/vaccine, and look at their frequently asked questions section. You can also follow the NET News team coverage of the COVID-19 pandemic at netnebraska.org/coronavirus. The Nebraska legislature is holding public hearings on proposals that senators will be considering this year. Here to talk to us about that is NET News legislative reporter Fred Knapp. Fred, how's that process going?
Well, it's different. It's all-day hearings to avoid floor debate. They people are all walking around wearing masks except when they actually testify. They scrub off the tables and chairs between testifiers. And so, for example, there was a big hearing on property tax limitations, not allowing local governments to increase property taxes by that much. And ordinarily, you'd have a room full of angry farmers and homeowners, and then you'd have upset school groups, and it could go into the evening. This time, it was over by 4:30. I mean, it was still contentious, but people are being submitted testimony electronically, and it's just not as visible.
So one of the big things that the legislature is going to have to deal with this year is redistricting. So where do things stand on that?
Well, it's uncertain. The stakes are really big. There's always a battle over the boundaries, for example, of the Omaha area 2nd Congressional District, which has implications not only for that closely divided district, but also for a presidential electoral college vote, as we saw this past year. It's a nonpartisan legislature, but the way the redistricting committee is set up, there have to be 5 members from one party and 4 from another, so you'll be astounded to know with 32 Republicans and 17 Democrats, the Republicans have a majority on this committee. But the census is now saying they might not have the figures that people need to use for redistricting until July. And if that happens, that's after the session ends, so we could either have a special session or like last year, they could suspend this session before it reaches an end and then come back and redistrict.
So with so much at stake, was the picking of this committee contentious?
No, the voting was very smooth. It was one ballot and they got their 9-member committee together. But the process involved some difficulty. The Appropriations Committee has been exposed to COVID by a staffer, and one of the members of the redistricting decision-making body, Senator Vargas, is on the Appropriations Committee, so he was supposed to quarantine, according to the chairman of the committee, but Vargas said he tested negative, and he wears a mask all the time. So he showed up. They had the meeting in the big legislative chamber with everybody separate. And another senator who was on the Appropriations Committee, Steve Erdman, said that he's had COVID. He hadn't told anybody because he didn't think it was their business. So he's around. So meanwhile, the Appropriations Committee, the rest of them are quarantining, and they're meeting via Zoom, and they're supposed to have a preliminary budget very soon.
So in the next week ahead, more hearings. What are some of the topics you're going to be keeping your eye on?
Well, they're everything from legalizing sports betting to requiring civilian police oversight boards in Lincoln and Omaha, year-round daylight savings time, and the list goes on. I won't be able to get to all of them, sorry.
Well, we'll have to settle with that then. Fred Knapp, thank you very much. You're covering the legislature for us. We appreciate it. And Fred does keep us informed on what's happening each day in the legislature. Listen for his updates on NET Radio. That's at 5:45 and 7:45 weekday mornings and 5:45 in the evening. You can also read his stories each day on our website at netnebraska.org/news. That's all for this week on Speaking of Nebraska. Thanks to Matt Bloomstead and Jane Hansmeyer, as well as Dr. John Trapp, for joining us, and to Fred Knapp for his reporting. Next week, join us for a discussion about casino gambling in Nebraska. Until then, I'm NET News Director Dennis Kellogg. Thanks for spending some time with us. We'll see you next week.